Hello and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at Celiac.com. And now, let's move on to the latest Celiac.com news. Celiac disease in children. Early signs. Parents should not ignore. Celiac disease is an autoimmune disorder that affects approximately 1 in 100 people worldwide. It occurs when the immune system mistakenly attacks the small intestine after ingesting gluten, a protein found in wheat, barley, and rye. For children, early diagnosis is crucial to prevent long-term health complications. Many symptoms of celiac disease in children can be overlooked or mistaken for other conditions, making awareness vital for parents and caregivers. This video explores the early signs of celiac disease in children, why early detection matters, and how parents can advocate for proper testing and diagnosis. Celiac disease is a genetic condition, meaning it runs in families. If a parent or sibling has the disease, the child has a higher risk of developing it. When a child with celiac disease consumes gluten, their immune system reacts by damaging the villi, tiny finger-like projections in the small intestine responsible for nutrient absorption. Over time, this can lead to malnutrition, growth delays, and other health issues. Celiac disease manifests in various ways, and symptoms can range from mild to severe. Many children with celiac disease experience digestive distress, including chronic diarrhea or constipation, abdominal bloating and pain, frequent gas, pale, foul-smelling stools, and vomiting, especially after meals containing gluten. Undiagnosed celiac disease can affect the child's ability to absorb essential nutrients, leading to failure to thrive in infants and toddlers, delayed puberty, short stature compared to peers, and weight loss or difficulty gaining weight. Some children can actually be overweight or obese because of the disease. Many parents report behavioral changes in children with undiagnosed celiac disease, including irritability or mood swings, fatigue and low energy levels, difficulty concentrating, sometimes called brain fog, and anxiety or depression-like symptoms. Celiac disease can also affect the skin and teeth and can lead to dermatitis, herpetiformis, an itchy blistering skin rash, dental enamel defects such as discoloration or pitting, and canker sores in the mouth. Children with celiac disease may develop symptoms affecting the nervous system and muscles, including headaches or migraines, joint or muscle pain, poor coordination, also known as ataxia, and numbness or tingling in the hands and feet, known as peripheral neuropathy. Delaying diagnosis can have serious health consequences, including an increased risk of getting other autoimmune diseases, such as type 1 diabetes, thyroid disease, and rheumatoid arthritis. If left untreated, celiac disease can lead to gastrointestinal damage that can cause malnutrition, delayed growth, and puberty, which are caused by poor absorption of vitamins and minerals. This can ultimately lead to anemia, osteoporosis, and other deficiency-related health problems. Long-term inflammation can ultimately increase the risk of intestinal cancers. If you suspect your child may have celiac disease, consult a pediatrician or gastroenterologist. The diagnostic process typically involves blood tests. For example, the TTG-IgA test is the most common screening tool to detect specific antibodies linked to celiac disease. When testing younger children, DGP-IgA and DGP-IgG, deamidated gliadin peptide, tests should also be done. A total IgA test is also recommended to determine if someone is naturally IgA deficient. All of these blood tests can be performed with a single blood draw when your doctor orders them. If blood tests suggest celiac disease, an endoscopic biopsy of the small intestine can confirm the diagnosis by checking for damage to the villi. However, very high blood antibody levels may allow for a diagnosis without this procedure. If a child has a family history, genetic testing can determine whether they carry the celiac-associated HLA-DQ2 or HLA-DQ8 genes. The only treatment for celiac disease is strict adherence to a gluten-free diet. Parents can help their child transition by reading ingredient labels carefully, educating caregivers, teachers, and family members about cross-contamination, providing gluten-free alternatives for favorite meals, and seeking guidance from a registered dietitian specializing in celiac disease. Recognizing the early signs of celiac disease in children can lead to an early diagnosis and prevent long-term health complications. Parents should trust their instincts and advocate for testing if they suspect gluten may be affecting their child's well-being. With the right dietary changes and support, children with celiac disease can lead healthy, happy lives free from the symptoms and risks of gluten exposure. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.